My name's Mary Chanter and I'm one of the coordinators at the New South Wales Elder Abuse Helpline and Resource Unit.
I'm Kerry Marshall and I'm the Senior Coordinator of the Elder Abuse Helpline and Resource Unit.
To start with, we'd like to define elder abuse. It's really important that we get a good understanding of what it is, and then we can go into some detail about the different types and signs and how to identify. In New South Wales, based on the World Health definition, it's been adopted by the new interagency policy for the state of New South Wales. We adopt a definition that's about a single or maybe a combination of actions or lack of appropriate action, perpetrated usually by somebody in a position of trust on an older person. And we recognise 5 different types of abuse. There's psychological abuse, which tends to underpin all the other forms of abuse: financial, neglect, it can be intentional or unintentional neglect, physical abuse and sexual abuse. And that's pretty much in the order of the prevalence too, in terms of the statistics.
What's really important with the definition that Mary just gave is hearing the position of trust. That's what's really important when you're talking about the definition, because what we're dealing with the Elder Abuse Helpline and Resource Unit is that it's someone that the older person trusts that abusing them. So that rules out things like scams or someone that's assaulted by an individual they don't know on the street or something like that. So just clarify for you, we don't deal with those things. It's not to say they're not abuse or assault or anything like that, they certainly are, but our definition and what we do as a unit is about older people being abused by someone that they trust.
And picking up on that, it's about an older person who's living in the community, and by community we mean living in their own place, in their own residence. And so perpetrators most commonly are an adult child, sons and daughters in terms of the statistics. We get calls from family members, friends, relatives and service providers as well, which is why it's really important to talk to people that are out there in the field working with older people so that they learn how to identify the signs or any suspicions or any concerns at all. We take calls from anybody, so predominantly we are a phone service and a resource unit. So we're funded by the state government, the Department of Family Community Services, to run a helpline for the state of New South Wales. Every other state has one too. We provide information, support and referral. So if an older person, for example, gives us a call, we can make referrals with permission over the phone for that person. So we're also like if a worker rings us up, and usually it's a manager or a service advisor, for example, or a social worker in a hospital, we can help them identify their concerns about the older person and, like a virtual colleague, help them develop a plan. Or we might be just like a sounding board for them. They're not really sure. We might refer them to the policy and to, in fact, their own policy, because the state policy is a guide. Anyone can ring us at all. We operate the helpline, not a hotline, a helpline between 8:30 and 5, Monday to Friday. And if we can't get to them straight away, we will ring them back and return their call. There's lots of risk factors for abuse, and sadly, because we're an ageing population, it is something that we need to take very seriously, because it's expected that the numbers of older people being abused will rise. For the older person, as we age, our social networks decrease, so that vulnerability and social isolation is number one. For a carer or the abuser, carer stress can be a huge risk factor, and so we like to look at it in terms of a society. We take what we call a societal approach. So we have to look at, if the older person's here and the person that is abusing them is in a position of trust, what are the other environments like? What else can we do to bring back some supports for that older person? We look at it holistically and in a restorative kind of way. So some of the other risk factors, obviously for the older person, cognition may be declining, or maybe even for the carer. The spouse might be a carer and they also have ageing cognitive decline and can't manage some of the behaviours. So sometimes it's very complex, because sometimes abuse is intentional and sometimes it's unintentional, because they might not have the education or the training or the will to be a carer. Now, I know I focused a lot on caring. Not all carers are abusers. It's a very complex area. So sometimes an adult child, for example, is having some issues in their own life. They move back home to be with mum and dad. So maybe there's some financial stress which could be a cause. A history of family violence, domestic violence, because elder abuse does fall under the category of family violence. And even financial abuse now, although it's probably sitting alongside domestic violence, people are now starting to recognise that financial abuse is part of that umbrella of family violence.
I think though, going back to what Mary was saying, to really sum it up, you've got two major things to, I guess, remember when you're out and in an environment where you think, could this be happening, or what are the risk factors? It's the dependency. The more dependent an older person is on their carer, the more, I guess, as horrible as it sounds, the more easy it is to abuse that person, because they are reliant on you. So if I'm an older person and I can't do shopping for myself, and you say, well, your bread costs $3, but you're going to give me $10 to go and get it, most people will probably do that because they don't have other options. And then what comes in line with that, as Mary was saying, is the social isolation. And that's what a lot of the time we call the enabler. And so that's what enables somebody to be abused. You get a carer or a family member, whoever it is, they start to isolate the person so that nobody else finds out about it. And then that's how it starts to snowball, and often we don't find out about it.
If we go back to financial abuse being quite a highly reported abuse type, older people can have quite high financial assets too, and we think that could be one of the main, it's well documented actually, that can be one of the main causes too. Or family members can't wait for somebody to die, unfortunately, and they have this sense of entitlement, or they're providing all this care and they might not be getting paid for it, and they feel that they can maybe, skim a little bit off their mother's pension when they're out doing the shopping. One of the most critical thing that we want workers to take away from any sort of training or education around working with older people that might be being abused is to know what the signs are for abuse, to be able to identify. Now, when we say identify, that can be a suspicion. It can be that they get a disclosure when they're talking, maybe providing a bit of family support and the older person discloses something to them, or they might see some physical signs of abuse. But some signs of abuse, sometimes it's very difficult because it could be contributed to the ageing process. Bruising, some older people bruise quite easily. So it's about being vigilant to the signs and the behaviours for each of those types of abuse that we've talked about. For example, an older person, there might not be much food in the fridge, but signs on their own might not be an indicator of abuse, but it might be as well. And so the important thing for a worker is to identify any suspicions at all, is to talk to their manager about what they see, to document, or the agency needs to document and be really, it's very important to document what they notice. But actually the most important thing is to also respond to an emergency. Now, what does that mean? That means if they need to ring the police or an emergency service like an ambulance, they do that obviously before they speak to their manager. So it would be really good at this point, I think, to go through each of the types of abuse and have a look in more detail about what the signs and the behaviours are.
And the really important thing there with what Mary's saying as well, often what we find is workers are nervous to call emergency services because they think, well, the client asked me not to, the patient asked me not to. So when it comes to privacy legislation, if it's an emergency, you don't have to get their approval. They don't have to consent to that. If it's an emergency, you actually have a legal obligation to call emergency services. For volunteers, they have similar, I guess, we would hope, responsibilities in being aware of the signs, what to look for, how to identify abuse, as Mary was saying before. We would then be asking them, obviously, if it's an emergency, within what their knowledge is of what an emergency is, they can call emergency services. And yes, we would expect them to. And apart from that, the main thing is talk to their supervisor. So every volunteer has a contact person within the organisation they work for, and don't talk to your supervisor tomorrow. You leave that house, or you make an excuse to get outside of the house if you have fairly significant concerns, call emergency services, or if it's not an emergency yet you're quite upset about what you've seen, call your supervisor straight away. And if your supervisor isn't sure, you say to them, there's a helpline, would you call them and ask what I should do or what you should do?
And that's a really important point, because even the smallest concern, just run it by your manager, because there might be already some notes from, say, a community worker about some concerns. And so it's building up a bit of a picture. And so maybe at some point in time we get managers, for example, ringing us saying, over the last 6 months we've had community workers, we've had a volunteer, all presenting, and we found out from a previous service that they had concerns. And so what we want, we're about prevention, and as was raised earlier about older people living a full and vibrant, safe, participating in life to the fullest for a healthy ageing population. If abuse does occur, we don't want it to reoccur. So it's about, at the first point of seeing something that is a concern, is to talk to their manager.
I think it's really important, I guess, to recognise for volunteers in looking for other things to be aware of, is we talk often about signs and behaviours associated with abuse. The really nice thing about being a volunteer is people accept you into their homes, and often they're quite relaxed because you're relaxed. You're like another community member, they befriend you. And that puts you in a situation where you probably are more likely to get a disclosure for people to share information with you. When other professionals are around, often what they'll find is what we call a hovering carer, and they don't let the older person speak for themselves. So as a volunteer, be aware of the unique situation that you find yourself in, and it may just be that you're the only one that gets a disclosure or has suspicions, and I urge you to please follow up on those with us or your supervisor.
It is a complex area. Older people often feel it's about family relationships, and they might say to a worker, they might disclose something, they might not want to do anything about it because it's about wanting to safeguard those family relationships. But there will be times where, but I think that the workers need to speak to their manager about that as well, and there will be times where confidentiality is lawfully overridden for the sake of keeping an older person safe.